A quick disclaimer before we begin, the PEMF podcast does not contain any medical advice and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to episode 25 of the PEMF podcast. Today we're actually joined by a guest that we've had on before, Deborah, and she's from Restoring Health. So that's a local clinic to us, but I'll get Deborah to introduce herself. We've come back here, so actually this is number 2, but what we're doing is we've come to Deborah's clinic, so we're actually in the practice where she works every day, so we're a bit more in her environment this time, and we've got some better sound equipment, so it's going to do this podcast much more justice. So Deborah, if you could introduce yourself and just tell us a little bit about you first.
Well, hi, Deborah. Recently just recently got married, which is exciting because it's really amazing to have you guys here. And it's been really, really lovely to host you because we love the clinic itself. So obviously we're based in Kent and we've started out this clinic as a soft tissue therapy clinic. But the reason that it's so lovely to have you here is my husband has actually done all the beautiful decor. So we kind of feel really chilled and really sort of excited to be able to just go for this podcast. But yeah, I'm, as you can hear, from South Africa originally, been in the UK for 23 years, originally studied Biokinetics, which is an honours degree in orthopedic rehabilitation in Stellenbosch University. And we've been here. I wasn't able to work in my said profession because of visa constraints. So very happy to say I'm a UK citizen now and was able to start in my profession again after having taken a detour into the care industry and working with adults with learning difficulties, and being able to just create something beautiful that was a little bit unexpected. I never set out to create a wellbeing center, but it's turned into that. And it's been an incredible journey of which NewMed and PEMF have been a huge part of that when we started out all those years ago.
Yeah, so we've actually known Deborah nearly 10 years. It's been a case of when we first originally set up the NewMed business, we met at an exhibition, and we were probably one of our first customers of ours. So and I think both of us have come a really long way since then, and we've learned quite a lot on that journey. So
absolutely, really early adopter, I think, because when we first got involved with PEMF, I've come from a very sciencey background and a very kind of a pretty boxed understanding, really, and needing all my T's to be crossed and my I's to be dotted. And when you first came along with this idea of PEMF, I thought it was a bit woo-woo. I didn't quite understand it. And having had results with our first clients, I thought there's something in this that's incredible. So I went and studied the science of it, and I've been absolutely blown away since. It's just so founded in really good research, incredible science and physics behind it, and it blows your mind because you don't always, unless you go into that depth of understanding, you don't always really know why it's doing what it's doing. But I think over the last 10, I think it's nearly 12 years that we've been working with PEMF. You get to know so much more about it. It's a journey where you're continuously learning.
Yeah. So your clinic is in Kent. So just for people listening, if you're in the UK and you're in Kent and you've not experienced PEMF before, then this would be a good starting point for you to come and actually use, because you've got a range of PEMF devices as well, from low to high intensity. So it's the kind of the full package here. So can you give us a little bit of background about Restoring Health as a business and what you can offer here? What kind of modalities do you offer?
Okay, super. I think we started off just with an advanced massage, soft tissue therapy, and that was going really, really well for a long time. And then when I met you, we started to add in the pulsed electromagnetic field therapy. And what we find now, where we've landed, is we've got 4 main pillars of the business. The advanced massage is one, the PEMF and bioresonance is the second one, and then we've got physiotherapy and biokinetics. So we go all the way from the diagnostic through a wellbeing journey, and we draw on all the resources we have and make a very bespoke program. And the fourth leg is the Art of Wellbeing, which is all of our courses. And actually, the PMF course is a part of the art of well-being, just to understand things further. So what we tend to do is we've found that the dynamite combination that I think sets us apart from other therapy approaches is to do the hands-on, the client to do the exercises, and for us to include PEMF where it's appropriate. And we are just getting the most phenomenal results. So I've actually grown my business concept, my business model around these kinds of technologies. And we've got our new slogan is restoring health is where high tech meets the human touch. Because I think, we're all sort of facing an era of AI and all these kind of really amazing technologies, but it's never going to replace the human touch. So we found a really unique way of combining all of those things to be able to get the best outcome for our clients.
Excellent. So when you first started with PMF, when you first met me and you started, you had this woo-woo technology that you'd suddenly kind of brought home to use on your clients and that sort of thing. Kind of, what training did you get, or how did you learn about this technology, and where did you go from there? Because a lot of people were looking into these different type of modalities to put into their practice now. So lots of different things like red lights and all different technologies. Like you say, it used to be just the human touch. Now things are advancing. We're moving on to different technologies. But how did you start? How did you put it into your practice, say, for example?
I tell you what, the speed at which this is gaining momentum is absolutely incredible. So when I started, when we all started, PMF was very little known in the UK. So I think you guys have done a fabulous job, and the practitioners that are working have done a fabulous job of sort of bringing it to the fore. But I started with just my own research. I just went into the books and I bought the books that were available, and I read those, and I researched online, and I looked at PubMed research papers. And then I think the first really exciting delve into the training was when NewMed brought Dr. Paulick over, who is kind of quite a guru in the States on PEMF, and a lovely person. And he came and spent, I think, about 4 days with us, and we could pick his brain, and he's got so much experience in being a medical doctor as well. I think that was something that really solidified things for me, and to hear all the testimonies of how he approaches what he does. And I think since then, the depth of knowledge that I've gained, mostly experientially, has been the key thing, because you can know something in theory, but when you can see how it can change someone's life, that's a whole other story. And I think with the knowledge that I've gained, I mean, we've sort of done a little bit of work on a course, because we've understood that there's so much out there, but it's such a vast field, and it's a little bit overwhelming. So what I've done is I've set up free consultations online. So people go onto the website, they book. You welcome anybody would like to call me, because there's so much out there, and I'm concerned that PEMF might get a bad rap if people are purchasing a device that is not suitable for the purpose for which they are wanting to use it. And I think that's what's been happening. You can get so many, there's so many devices on the market, but they don't all do what they say on the tin. So an example would be, if somebody is trying to address osteoporosis, you've got to make sure that the therapeutic intensity is strong enough at the surface of the body to be able to actually get to the bone. So if you're using a mat with a very low intensity, that's not necessarily going to bring about the results that you need for that kind of condition. So it's not that high intensity is better than low intensity. It's just that it's very important that people find the right tool for the job.
Yeah.
So, the first experiment that I did with a client was on a really low intensity mat, and they had fibromyalgia, and it completely changed their life. They were going to rent the mat for 4 weeks. After a week, she'd had such a change that she said, "Where is it? I need to buy it." So, for certain conditions, the low intensity, and for general well-being, is absolutely fantastic. I'm sure we can delve in a bit later in the podcast as to which does what. But I think that, together with the fact that I have purchased a huge variety of different intensities and types of equipment, and I think the key thing is just to find, like I said, the right one for the job. We've got lots to try, lots to trial.
And no, that's great because, our journey together has really helped NewMed as well as yourselves to really understand what intensities work for different people.
Yeah.
So, we don't necessarily have a treatment center at NewMed. We're more about providing the devices, getting them in from different countries and making them available in the UK. But we don't necessarily see so much the results that are coming through. We can get customer testimonials and we can get feedback from clients, but you can see it in front of your eyes. You're seeing how people react differently. And between those two knowledges, we've managed to build these 3 courses, which is like you said, you can get lost in PEMF. You can spend hours on the internet and you can read all these different things, and we get it all the time. People just come to us and go, their head is just, they've done too much research. And the problem is if you go to specific manufacturers, they'll make certain claims to make their products sound better and maybe make worse claims about the other products that are on the market and those intensities to direct you towards their product, and whereas we can actually use them on people and see the differences and see where high intensity versus low intensity is better. Yeah. So putting that all together, putting our knowledge together, we've managed to get together and create these level 1, 2 and level 3 course. So level 1 and 2 is completely online and it's really breaking down the fundamentals, taking away all the confusing side of things and getting people to just understand PEMF back to a basic level. And if they're going to apply that to people. Level 3 is actually an in-person course. So we feel like that was quite important that people, if they want to go up to the level 3 certification, then they can come to this clinic in Kent and they can pick your brains for a good 4 hours of training and just really understand the differences between the PEMF devices and how you apply them. And it's an opportunity for the learner to actually start asking you questions.
It's it's been a really important process for the people that I've taken through that course, because to see it in application is so much easier than just receiving this amazing device and going, I don't know what to do with it.
And we see it too often that people are using what we would consider a home use device, like a home use daily PEMF device, and they're using it on a clinic once a week on people, and they're wondering why they're not getting such immediate results. They might be using something that's not quite suited to what their application is.
Yeah, and that's what I was saying about the consultations, is to try and marry the problem with the right product. And that's one of the things I've loved about NewMed, is because you've got that range of products. I don't feel like I'm in one of those situations where we are saying to people, this is one size that fits all. This device will do everything. And sadly, it really makes me sad. It makes me quite emotional. People in really, really difficult situations. I can recall one person with Parkinson's, for example, where what we're speaking about has happened. And obviously everybody is well-intentioned and people believe in their product, and that's good. That's why people sell the products that they have. But this particular person I'm thinking of purchased a product that was not right for her and is in a very difficult situation. It cost them a lot of money, and over the last 18 months they've not seen the results that they could have. And you look at someone's home life and their support structure and their social circumstances, and you think this is a person that just really needs a break. And I think that's what I'm trying to do, to help people, inform people to make the right decisions from the outset, because any marketing can be, everything's fantastic, and it's so important that you get the device that you need. Critical.
And that's something that we talk about a lot on NewMed as well. It's kind of like, speak to us, talk to us, tell us what's going on, and we'll point you in the right direction.
And honestly, even I mean, I don't know if I should say this openly on a podcast by NewMed, but even if I feel like we don't have the right tools for someone, I will never say to someone, it's so easy. It would be so easy to just say, do that. It will, spend X amount. It'll do X, Y, and Z. But if I don't feel that it will help in their condition, or I don't feel that it's the right thing, I will point them in a different direction, because it's got to be right. And PEMF, we want people to understand the value of it rather than just think, that didn't work. And then it gets a bad rap, and it doesn't need to.
No, that's good.
Revealing my secrets.
Yeah, that's it. So let's kind of break this down and talk a little bit about the application here. So say, for example, you've got low and high intensities. Like how do you put that into your
How do
you put that into a 45-minute or 50-minute session?
Okay.
Are you putting people on a mat and massaging them on top? Are you applying it to certain areas of the body? How does that look?
Oh, okay. The reason that's such a broad question for me to answer is because it is genuinely so bespoke.
Okay.
So we draw on all the resources and we decide what we're going to do with each client depending on what we're dealing with. But I can talk you through how we would generally look at doing that. So because we're in a clinic environment, we like to be using, like you said earlier, there's no point in people using low intensities once a week because they're not going to get the results. I always say any PEMF is better than none. But what we would do is we've got high intensity devices. So we've got a Zimmer MPhil Pro, we've got a HUGO device, the sandwiched approach, we've got a Curatron, and between a Curatron 3D, I think it's called 3D 2000s. So, and we also have medium to low intensity devices. So I don't want to leave any out, but we've got the Celerate, which is fantastic. We've got the Biomag, we've got the Flex Pulse, which is absolutely brilliant, especially for sports people. So what I tend to do is we encourage people to do the high intensity stuff in the clinic because you see quicker results, and to then my hope and my desire in life would be that every household actually has a PEMF device because I just think it's a phenomenal technology. But I think we're fighting with a difficult culture in the UK because we've been so used to the NHS fixing things. I think I'm starting to see a trend now over the last 15 years where people are taking a lot more responsibility for their own well-being rather than going to the doctor and saying, I've got this problem, can you give me a tablet for it? There's been a real move towards well-being, specifically post-pandemic. So that I think is, people are looking into that more, but we will always offer people a PEMF trial of a unit that is less intense to be able to resolve a particular problem that they have. But it is quite difficult for people to change the mindset from coming to a clinic like this proactively. So from actually coming because you're in crisis, you're in pain, you want something dealt with, we deal with the symptoms and often we'll move into a maintenance program. But for people to then take that step further, that is my hope, that they would be even more proactive. We've had a lot of people that have done that, but it's not the general kind of way of doing it. So come back to answer your question, what we would do, an ideal situation, if appropriate, we'd have somebody on the HUGO, which is the full body sandwich device, before treatment. Because where that's incredible, it's got quite diagnostic in value for us. Because say, for example, if somebody comes and says, I've got pain in my shoulder, with where they're pointing to the pain is not necessarily where the pain is coming from, if it's referred pain. So after a session on the HUGO, we would say to them, where did you feel that more, where was it more uncomfortable for you? And they will point to the area that the pain is originating from. And as a result of that, we can then go in their soft tissue therapy or advanced massage treatment and focus in on that area. And it's always coming from the point that the PEMF identifies, always. So that's one way that we integrate it. And then the other way is with the Zimmer MPhil Pro is just a box of miracles. We first bought it. It was a huge investment, bearing in mind people didn't really know at the time what it was all about, but it's been an absolute game changer for us. Absolute game changer because you get the results so quickly. So with that, both our childhood physiotherapist and myself work with both modalities simultaneously. So we will book a session that includes both advanced massage and the MPhil, and we will either where it gets really exciting is when you're trying to put a puzzle together. Somebody comes in with 3 or 4 different things going on, and normally we would say to them, listen, I can only deal with X today. But what we do is we would be working on their neck while the MPhil's working on the knee, and then you get them in the different position and you kind of work with the device. And you can also go in and immediately feel the palpable changes in the muscle. So we do that a lot, where we either use the HUGO in the beginning that identifies the problems, or we would work together with the MPhil.
So, okay, so that a lot of the time you're kind of leaning towards the high intensity stuff, and you actually asked me my next question, which was the diagnostic thing, because that was something that you've spoken about in the past and really kind of interested me as to, not necessarily where the pain is can be the problem. And the high intensity device is really good at picking that up.
Can I share another one? I'm so excited about this. So one of the main things that we do is what the M field does is it will show us where muscles are not engaging properly. So that is a neurological problem. So that is where there has been an injury, either a micro trauma through somebody's posture, for example, or driving all day, and the glutes start to switch off neurologically. So in my understanding, what happens is the firing threshold increases. So what the M field does will firstly identify which muscles are not working properly. And if you think about how important it is for all the muscle groups to work together, whenever one is not working, others will be overworking, and that is what will cause the pain. So to come back to the diagnostic part, if we can identify muscles that aren't firing, for example, 9 times out of 10, if there is pain in the right of the lower back, the right gluteal won't be working. And what we do is we get the PEMF to help the muscle reach the firing threshold, and that in itself starts to lower that threshold, which means then we can give exercises to people because we've instilled the power of the muscle, and they just need to then use that power to strengthen it. So that then starts to balance your myofascial trains, how muscles work together, and the results are incredible because once the muscle has started to engage, as long as they're exercising and keeping it going, as opposed to other therapeutic approaches might be, let's exercise to get this muscle going. But no matter how much somebody concentrates on trying to get that going, it's very difficult. And they end up actually reinforcing the problem when they exercise, in my humble opinion. I don't want to diss anybody else's approach. But I would have had exactly the same approach as a biokineticist before I found PEMF, because it tells you something that you can't really accurately and objectively assess otherwise.
No, very good. Okay, so do you ever get people that come and just specifically only use PEMF?
Yes.
Yeah. Okay,
Yes.
Can you tell me about who that and are you getting benefits just with that?
Absolutely. So examples would be, just trying to think of real examples for you. There's a lady that comes in through her anxieties, really struggles to breathe. And she has found that the HUGO is the only thing that helps her. So she phones up, she says, I'm having a really rough time. My anxieties are through the roof. Shallow breathing. And she goes on the HUGO and she puts it as high as she can cope with. And afterwards, it completely settles her. So it's impacting the nervous system. And it's just allowing her to have that expansion. Obviously, what it's doing without getting into the science of it, the outcome of what it's doing is increasing the diameter of the blood vessels. It's stopping the Relu effect that tends to happen where the red blood cells stick together. So there's more surface area for the oxygen to actually penetrate the cell. So you get not only a better volume of blood, but you get a better oxygenated blood. And all of those things are serving to support her breathing. So that's one example. The other thing that the M field is incredible for is arthritic conditions. Phenomenal with hands, and any other condition really, but we see a huge result with hands and wrists. So people will come, and rather than being on medication, they'll come regularly when the pain gets a bit too much, and they'll have maybe 3 or 4 sessions to start, and then we put them on a maintenance program where they come regularly for that. So yes, there are definitely circumstances where we might put people, if we find muscles, for example, that are not engaging properly, we'll have a series of treatment for them just to get that muscle engaging. So that's all they will have. Another way that I use it is I do some other technologies, which maybe we can come to a little bit later. But when I've identified certain things with a different technology, I will often, when people are dealing with very low energy, or they have got high anxiety, I would have a series of HUGO sessions for them in order to just put them in a better place to be able to then take the next step forward. Because sometimes we're seeing a lot of this where people are so depleted of energy. Their energy levels are so low that they don't have the energy or the mental capacity to take that next step. So
Yeah.
it's easy to come and say, listen, do this 3 times a week for a couple of weeks and see that improve, so that you can then start to make better decisions for your long-term well-being.
And is that chronic fatigue syndrome that seems to be something that's coming up quite a lot and more frequently spoken about now?
Yeah.
Is that people that specifically with chronic fatigue syndrome, or just in general people that have really, really low energy levels? Or is...
In my experience, I've not worked with a lot of people with chronic fatigue, so we don't necessarily have people coming in with that diagnosis, but the symptoms are very similar. And I think if left unaddressed, it would result in that kind of diagnosis: fibromyalgia, chronic fatigue syndrome. But yes, so not specifically, but the symptoms are similar.
Yeah. Okay.
Yeah.
So you mentioned before about the differences between low and high, and your ideal situations when people come in and you're treating them on the higher intensity systems. So lower intensity systems, where do these fit in? Like you've mentioned to me before about getting people to, if they've got the money, to invest in a system for themselves. So is that where you think they're better suited?
Yes. Yes, because you want people to be more proactive.
Mm-hmm.
So the kinds of things that I would do with the lower intensity systems, or medium, I think Biomag wouldn't be happy for me to call theirs a lower intensity, but in comparison to what else we're using, they're much lower in intensity. But I would say, for example, we're helping someone who's got a knee injury and they've got a very swollen knee and there's inflammation. I would be treating them in clinic and then say to them, hire this device out for 2 weeks or a month and use it every day, and I'll show them exactly what programs to use. But if we could take it beyond that, I think, the benefits of this, it basically slows down the aging process. That's a really big thing, because it's dealing with inflammation. It's just doing so many things physiologically that could help people to prevent illness in the future.
Yeah.
So that is my heart, to get to people to understand where they're at and how to go from where they are to where they want to be. And PEMF could be a very, very big part of that. And it is a big investment, but I think it's a very worthwhile investment, because you can use it for your aunties, your uncles, your grannies, your kids, your dogs, your cats. Do you know what I mean? It's something that the whole family would benefit from.
Yeah. So ideally they're using that on a daily basis, and then they're coming into you for the higher intensities, something that is going to hit them with higher intensities and have more immediate kind of results and diagnostic results for you guys. So it's kind of like a full package. But in terms of the recovery and preventative going forward, and it's good to see that the shift in health, I think, is changing slowly. Definitely in America, we're seeing this quicker than it is in the UK.
Okay.
But yeah, in the UK, the preventative health now, I think, is becoming something that people are starting to take notice of. And if anything, for you, you want the best for your clients, but if they're going to get into preventative health later on down the line, you may not see them again, that's
great, because then we'll see other people. That's great. We don't want the same people coming back for the same problems. We want to be able to. So what we do with our Wellbeing Journey is we take them literally on a journey, and there's so many different things we could do to put into their lives along the way. There's education, there's courses, there's all kinds of things, but you want to see people fly. You don't want to see people keep coming back for the same old problem. That's terrible.
Yeah, exactly. No, that's great. So you mentioned you're doing some other modalities here and some other different technologies and stuff. So did you want to just introduce some of those, just so that people understand, what they can find here, but what maybe someone else can offer in their practice?
Absolutely. So firstly, I would say anybody doing something similar to us in a wellbeing setting, thinking of purchasing PEMF for supporting people in their clinic, don't hesitate. Please phone me. I will talk you through the benefits of it directly. We can make that, a bespoke conversation, but it enhances the healing process. So the other modalities we have with the advanced massage, we work on different things. So we have a hydrotherm, which is like a big hot water bottle that you stay on your back for, and it can be configured differently for pregnancy massage. We do specifically pregnancy massage, and you have the massage between the mat and your body with coconut oil. It's absolutely incredible. And the buoyancy of the water helps us see the movement patterns, and the healthy muscles can just relax, and we can really get into the tissue that needs releasing. So that's it. We've also got a cyclomassage, which is something that has just heat and vibration that we use as part of our massage. We have in fact, it's in this room. We have a beautiful Vario couch, and that's got heat and vibration, but also PEMF in it. So we get people to come in after their treatment, and they can literally be in this room, shut out from the rest of the world for half an hour. We can either have them doing meditation. So we use EquiSync, which is 5 different layers of sound technology that intertwines for brain entrainment. So people that are they struggle, either sort of high functioning, or they're in CEOs of businesses, or they're a mum and they've just got so much going on all the time. People that really need to learn to just go, because this life is crazy at the moment. There's so much that's being thrown at us. And I think the success is going to be in how well we manage our stress, because we can't manage what's coming at us. But it's just about knowing what to do with it when it comes, and increasing that internal resilience is a big part of the message that I give. So we do that. Or sometimes they come in and they have an eye massage. So we got this really funky eye massage thing that happens, just that space to completely chill out. We've also got a little private exercise studio, so people can come in and make use of that. And our physio uses that and we give bespoke exercise programs. We use a program called Web Exercises. So we integrate all of the exercises that they need to do on a program that gives videos. So we go through everything with them. I'm very anti somebody pulling an exercise program out the bottom of the drawer and going, here, do these. It's like red rag to a bull with me, because obviously my specialization is exercise. So it's so important to modify exercise specifically for people. And I think that's something I'm going to really hold on to, because anybody can go online and do an online course. But what is really special about being able to be face-to-face with someone is to be shown exactly what you're doing, how to do it, where you need to modify it for your particular condition, and then go off and do it at home. That's great. We don't offer classes here, but we want to educate people. We also do posture screening. So we have a posture screening software that we can do an assessment against a plumb line to be able to see where the postural deviations are. Then we use the exercise program and the PEMF and the soft tissue therapy to be able to correct postural habits that are kind of well entrained, but that are causing problems symptomatically, because there isn't such thing as a perfect posture, but it's really important that where postural deviations are causing a problem, we can address that. So that's the approach that we have. What else do we do? Something I'm not sure whether I should mention, but I'm going to step out in faith and do that. I'm just starting to dip my toe into bioresonance. And I say that cautiously because it is a massive subject. I've had the honor of being trained by one of the top bioresonance experts in the world, Dr. Yanis from Greece. And what we're doing with that, I just feel that people are coming into our center with so much more going on than what we're able to address at the moment. And I think this is something, with the stress that the NHS is under, difficulty in people getting a diagnosis, long-term waiting for treatments. I think this is something that's really needed. And being that early adopter, which my husband doesn't always appreciate because it's a scary thing to do and you've got to throw a bit of money after these things. But in faith, I want to be one of those people that can use bioresonance to diagnose things. It wouldn't be a diagnosis as such because I'm not medically trained, but the technology would give an indication as to the pathology, the primary organ, and the cause. And then we treat that. And just as much as PEMF is all about frequencies, bioresonance is all about frequencies. And the difference is the intensities are very low, but the frequencies are very, very specific. So I'm not going to go much more into that because, that's a whole subject on its own. But I am starting to learn, and I'm excited about that. And we use a company called Data Ellis. And one of the their products that I'm very familiar with and we use as a health scan is called the Depulse. And what this does is it's a heart rate variability monitor. And you have just, so we're testing people's heart rate variability, and it is specific to that slice in time. So it's not something that you would wear for long term, but we have something that we move on to, and that's first beat. So we then give people first beat monitors to be able to know how their heart rate is affected in everyday life and decisions that they're making and activities that they're doing. But what the Depulse does is it gives you 15 different windows of your functional health status. And that is both in a Western understanding of medicine and an Eastern understanding of medicine, which I never really understood before. And I would always go, I don't get that. But I've come to realize that this particular device bridges the gap in understanding between the East and the West. Because in the West, we're very much about symptomatic relief. And in the East, they're very much, the modalities and the models that they use are more holistic. Let's say, holistic is a word that's bandied about a lot, but it's much more sort of global in its approach. And I've come to see that we're both just looking at the same problem from a different perspective. Yeah. And when you can put both perspectives together, it's really reading, in a nutshell, how effectively we are managing our ability to adapt between the fight and flight mode, the sympathetic nervous system, and the parasympathetic nervous system, which is your rest and digest mode, and all the different repercussions of that in our body, the state of our brain, the brain frequencies, fatigue in our brain, looking at all the different organs and how they're functioning. So all of those things from a Western perspective, but also looking at things like meridians and chakras and things that I'd never really been known about. But to be honest, that's why I've had to buy a box of tissues. Because when I start to look at the insights that part of the program brings, people just start to cry and they start to release tension and they realize where they're at. So what we do from that, and that's one of the things that I identify where people have very low energy levels. So that's when I would say, listen, your next step is let's just get those energy levels up. So we can either use the bioresonance devices, or my biggest go-to is HUGO, because it's much more immediate. And they can feel the difference much more quickly. And then from there, we would identify what road and what path they need to walk. And PEMF is a very big part of that most of the time. So we put them on that journey depending on what their needs are.
So just coming to the last couple of questions, really. We spoke before about a couple of client testimonies that you had. We had the fibromyalgia. We had a builder in the last one who had a bad back. Have you got any more that you can think of, off the top of your head? I know it's kind of putting you on the spot, but any more that you think, that the PEMF was really the defining feature for them, something that really was the key to their success?
Actually, absolutely. So there's one particular client that comes to mind, and the end of her story was incredible. She had some serious back operations, a couple of them had gone wrong, was taking handfuls of pain medication. And again, that's something that PEMF does really effectively, is rather than getting into that space of the opioid crisis and where people get addicted to pain medication, they're able to actually manage their pain through PEMF. But to start with, that wasn't happening. So her lower back was really painful. Just to be able to cope with life, she was having to take all these drugs. And we found out that one of the biggest problems were her gluteal muscles, as I mentioned before, were not engaging. And it took all my tenacity to stick with it because I'd had such good experiences with the PEMF. I believed in it wholeheartedly. But 10 sessions later was the first time we saw a glimpse of activity in the glutes. And she was incredible because she just kept saying, I believe in it, Dev, I trust it. I trust what you're doing. And literally 10 sessions. It's never taken that long to actually get muscles to engage with the infield. So this is not a normal sort of story. Usually we get those things resolved in 3 or 4 sessions. But she stuck with it to the point where that was the absolute defining moment, because after that we could get the mobility, We could get her to strengthen the muscles. I really believe with my whole heart that if she'd not achieved that milestone, she wouldn't be where she is today. And after 4 months of working with her, by that Christmas, she was skiing in the Alps with her kids. She was skiing in France. So just an incredible testament. And then I saw her about a year afterwards, because I thought that was quite sort of in the early days. And I thought, I wonder if that's going to maintain. And it absolutely did, because she'd kept up with the exercises. So once we get the muscles engaged, it's not really something that you need to just keep coming for. Once they've started, and you keep them going. And in fact, that's something that I'm wanting to do again for people thinking of, engaging in this from a professional point of view. I want to get a network of personal trainers and offer the service to their clients to say, let's just do a full PEMF MOT on their body and be able to give them as professionals, exercise professionals, the information as to which muscles are not working and not coming to the party and not being a team player, so that they know specifically what to focus on. So we do that quite a lot as well. We work with people's personal trainers in order to give them lead and guide as to what they need to be doing, whether it's just general fitness or whether it's to address a particular injury. So
Okay.
Yeah.
No, that's an amazing story. So thank you for sharing that. I mean, we could sit here and talk for hours, Deborah, and we could give away all the secrets, but we don't want to do that just yet. Got plenty more podcasts we can open up to that. So, really, just to wrap this up a little bit, if anybody's listening to this and they're located in the UK for starters, Kent or London or surrounding areas, coming to Restoring Health really, and hopefully my wife won't mind me saying this, but I'm putting you in care of my wife recently. She's come to see you because you guys offer the full package. It's not just one modality, try this, come for a massage, see you, we'll see you for next week for the next massage. There's so many things that you guys offer here that's, like I say, the complete package. You want to understand what's getting this person to this point. So really want to make a big point of that. And if people are very new to PEMF, if they want to understand it a bit more, if they want to come and try a system, an end user looking to buy a system for themselves, and again, it's something they can come here to try and speak to you about the different systems, as well as people in just crisis in general. They're in good hands here. So definitely would be somewhere that I would recommend they start as a starting point. And just in PEMF in general, NewMed is always there to help this along the way. And like we mentioned before, we've got the 3 courses available. So you kind of touched on the opioid thing, and one thing that I wanted to kind of finish off with is that people mention these buzzwords like spiritual, frequencies, magnets, all these sorts of things, holistic, and I feel like the shift is coming. Because you're looking at the medical industry, the people we trust with our health. We're seeing the opioid crisis going on at the moment and all these different things. And I think the trust is starting to diminish. There's other ways, there's other alternatives. People should be looking after their health, and also from a proactive standpoint, which we've touched on in this. So again, don't let yourself get to the point of crisis. We need to be working on ourselves to prevent these from the outset. So I think we've really kind of touched a few different heartstrings in this podcast today. It's been really useful.
And I think it's my personal belief that electromagnetic medicine is going to be the future of medicine. So if you look at things like brain surgery being done with ultrasound frequencies, I saw one recently on the heart. So I think, as you say, the knowledge is increasing vastly in this area. So keep up to date with it.
Yeah. Thank you so much. And thanks for joining us again, Deborah, today. If you're listening on Spotify, please leave us a 5-star review. And if you're watching on YouTube, you'll see this lovely setting we're setting in today. Please leave us a review so we can get a more amazing guest like Deborah joining us.
Thank you, Andy. Thanks for having me on.